8 young women between the ages of 17 and 20 were injected with infectious material from syphilis patients in 1892, and not one of them knew it was happening. This is the Neisser syphilis experiment. Welcome back to the lab, my curious test subjects. I am your mad scientist, and today we are diving into the story of how one German doctor, one terrible idea, and 8 unwitting victims created the world's first laws protecting human research subjects. Grab your lab coats. This one gets dark fast. So how exactly did a respected German doctor end up injecting 8 women with one of the most feared diseases of the era? Let me introduce you to Albert Neisser, brilliant dermatologist, rising star in German medicine. And, in 1892, absolutely obsessed with finding a vaccine for syphilis. Now, syphilis in the 1890s was everywhere. No cure, no prevention, just slow, inevitable damage to your brain, heart, and nervous system. Neisser thought he had a solution. Think of it like a clinical trial, except there was no trial, no clinic that cared, and definitely no paperwork. In medical ethics terms, that means he had zero oversight, and even less accountability. So Neisser ran his first test. He took cell-free serum from syphilis patients and injected it under the skin of 4 young women. One of them already had gonorrhea. Spoiler, this will not end well for anyone involved. The idea? Maybe exposure to weakened syphilis material would protect them like a vaccine. First round, 4 young women. Method under the skin. Result? No syphilis. Neisser's conclusion. Time to go bigger. So he changed the method. Next time, he would inject live syphilitic serum directly into their veins. Second round, 4 more women, ages 17 to 20. All prostitutes. Method, directly into the veins. Result, every single one of them developed syphilis. Now, you might be wondering what happened when all 4 of them got sick. Neisser had an explanation. He claimed they must have contracted syphilis the normal way. You know, just coincidentally right after he injected them with syphilis. Because clearly they got syphilis from somewhere else, right? Imagine if a pharmaceutical company today said, yeah, all our test subjects got the disease we were testing, but that is probably just a coincidence. The public did not buy it. Word got out, newspapers picked it up. The outrage was immediate and loud. These women had never consented. They had no idea what was being injected into them. And Neisser's response was basically, trust me, I am a doctor. The scandal reached the Prussian parliament. In 1900, they issued a directive that changed everything. No more experiments on humans without express consent. In medical ethics terms, that means the first international rule protecting human research subjects was born from this disaster. And here is the kicker. Most physicians at the time supported Neisser. And that is how 8 young women, 0 consent forms, and 1 ambitious doctor created the world's first human research protection laws. In medical ethics terms, that means it took a public scandal, parliamentary intervention, and the minor detail that every single test subject got the disease he was supposedly trying to prevent to make anyone care about consent. Progress. If you found this disturbingly educational, my curious test subjects, subscribe for more experiments that should never have happened. Leave a comment, stay curious, stay ethical.